Okay, it should be working now. I'm going to start over, okay?
Okay.
Okay, so why did you decide to retire?
Because of health issues.
Okay, does your decision to retire have anything to do with healthcare reform?
No.
English being your second has English being your second language impacted how you communicate with patients?
Excuse me. No. I don't think it was a problem.
Okay, have you noted any benefits in being bilingual in your healthcare career?
Yeah, I think it benefits.
Okay. So have you gotten to use your other languages with patient interactions?
Probably Thai German, not Swiss German.
Okay. Can you tell me of any times that you've had a communication issue with a patient? Or can you remember any?
No, I can't recall any. No.
Okay. How do you think health communication has changed during your time as a nurse?
The computer is a bigger, made such an impact, so it kind of changed the relationship between the nurse and the patient relationship.
Okay.
Because everything is computerized.
Have you noticed a shift in healthcare from your role as a healthcare professional to a patient since you had surgeries recently?
Yeah.
Okay. Let's see. Were there things you would have liked to be more informed about concerning the surgical procedures you've had?
No. Because with my background, I had a good knowledge about it, so.
Okay. So since you're from Switzerland, how do you feel the U.S. healthcare system compares to Switzerland's?
It's so different because it's not run by the state, so it's it's easier to get insurance over there, and it doesn't cost as much per person. So,
Do you think the U.S. should head in that direction or keep their current system of private health insurance? Do you have an opinion on that?
I think they need to change it because it's not working the way it's right now. I don't know how it's going to affect with the Obamacare. It might change.
Okay, and since you've worked in several hospitals, how have the organizational structures in healthcare delivery been different or the same?
They're pretty much similar. Compared to my second job, it was like a lot larger corporation, so I guess it was on a larger scale, and it did affect the care. So.
Okay. What kind of criteria do you and hospitals that you've worked in use for assigning limited resources? Like in my class, we've talked about whether it's like ability to pay or the person living longer, things like that. Do you know of any that you or your hospitals have used?
No, I wasn't involved with that aspect, so I don't think so. The ability to pay, it probably affected in a smaller hospital. The smaller hospital was not for profit, and actually McLeod is not for profit either. So it does affect it. It's not like a business, so it does affect it.
Okay. What approach do you believe in with caregiver and patient interactions? Are you more of the simple and easy to comprehend, or do you give a fully informed synopsis of what's happening?
It all depends on the patient's education. It's based on what their knowledge is, so you adjust it to each individual. If you have somebody with a fourth grade education versus somebody with a 4-year college degree, you approach it different. You put it on their level. So.
Okay. What have you attempted to provide, and does that match what actually happens during an interaction? So, do you usually go into a patient caregiver thing thinking you're going to say one thing, and does that usually happen? Like, do patients ask a lot of questions?
It depends. When you do a lot of teaching, you encourage them a lot of questions. So it all depends. What are you doing? Like I said, if it's when you do teaching, or for example, like if you give chemo, you go into a lot more details and you give the patient a chance to ask a lot of questions. But even with every day task, you encourage them to ask questions if they have any.
And which approach would you say that you've seen more as a patient? Do the doctors you've worked with usually keep you fully informed, or just basic knowledge? I mean, you know a lot because you are a nurse, but...
Yeah, well, it's a combination of the doctors and the nurse. It's like teamwork. You work together. That includes the other department too, social services and dietitian, physical therapy. It's a team effort.
Okay. Let's see. You have several grandkids. What do you think is important to communicate about health care from an early age, or about health from an early age?
I think it's really important because of, especially good nutrition, and because you can never start too early, so it's easy to start earlier and try to do it when they get older. So.
Okay, and since you have a lot of experience as a caregiver, what do you think is most important to communicate to young adults and teenagers about health?
Well, one thing, not smoking, it's one of the big things. And then good nutrition, and try to stay away from junk food and, fast food, which is not always easy, but that's an important factor.
Okay, and then you don't have to talk about this, but can you tell me about why you decided not to work at Conway Hospital anymore?
I just want to go to a bigger hospital and get experience. Because it's a different atmosphere. So.
Okay. I think that's all the questions I have. Is there anything you'd like to add?
No. If you have any more questions, just let me know, and we can do it later on if you have anything else that you want more details on.
Okay, thanks. I'm going to stop the film now.